Irritable bowel syndrome, IBS, versus colitis. Similarities and differences. Irritable bowel syndrome and ulcerative colitis are chronic conditions that affect the digestive tract. These conditions may have similar symptoms, but there are important differences in how they're treated. Irritable bowel syndrome, IBS, and ulcerative colitis are conditions that affect the gut and cause gastrointestinal symptoms, such as stomach cramping and abdominal pain. While their symptoms may be similar, their causes and treatments are different, because both conditions can greatly affect a person's quality of life. A correct diagnosis is critical for appropriate symptom management. Keep reading to learn more about how these conditions are alike, how they differ, and what tests can help tell them apart. Ulcerative colitis, like Crohn's disease, falls under the umbrella of inflammatory bowel diseases, IBDs. Ulcerative colitis is characterized by chronic inflammation caused by immune system reactions to bacteria within the colon and other triggers. Symptoms of colitis may also affect other parts of the body outside the gut. IBS is a functional gastrointestinal disorder. It's a group of symptoms that causes recurring abdominal pain and bowel movement changes. These conditions have different causes and potential long-term effects. As a result, they also have notably different treatments. While it's technically possible to have both IBS and colitis, these two conditions aren't connected. Both IBS and IBD cause gastrointestinal symptoms, including abdominal pain, cramping, and diarrhea. Likewise, both conditions are chronic. Both IBS and IBD can be managed with appropriate treatment. Other similarities. Both may be linked to genetics. Both may start at any age. Both may get progressively worse without treatment. Both may result in psychological distress. The abbreviations, IBS and IBD, are also similar and may cause confusion. Doctors explain, though, that having IBS isn't a first step to developing IBD and vice versa. The symptoms of IBS and IBD can be similar and difficult to tell apart on the surface. One of the biggest differences between the two conditions is that ulcerative colitis causes visible signs of damage to the digestive tract, whereas IBS doesn't cause these visible signs. Imaging tests and other diagnostic tools can help with a correct diagnosis. A doctor may use a colonoscope to look for inflammation that's characteristic of colitis but isn't with IBS. Stool samples, blood testing, and other tests may also help diagnose colitis. There's no specific test that's used to diagnose IBS. Instead, a doctor will record your symptoms and perform additional testing, stool samples, blood tests, imaging, etc., to rule out other conditions, such as IBD or colon cancer.